work with it. Therefore, we can achieve exact patient-centeredness. If you are sick, every aspect of the body is sick, even including your mouth. Sorry to say that. So maybe a patient will be sick and maybe a sick person. The values, you also put that in place. Timeliness, as I said, in case of emergency, the way we respond to emergency situations is very key. We should put that in the back of our mind. Efficiency is very also key. Optimizing resources, minimizing waste. As you all, we don't have adequate resources in our various fields. And sometimes, I'm really glad to say, some people also improvise some of the resources that they use in order to also help patients achieve their ultimate outcome. In some cases of MPOS, of which Ashanti region have recorded almost 2 cases. One is at Ahafo, and the other one is, I think, Please me, they don't take me because it's off record. So in this district, we are not fortunate to have, but at least we are responding to infections. So that one, we are playing a very good role concerning that. Fostering international collaborations is also very important. Encouraging global partnerships and corporates to address health challenges. So as we are aware, the key skills for nurses leaders include communication. Previous speakers have talked about it. Now I heard our chairman talking about communication. As we are aware, communication is also very straight. Like seeing ourselves that we are not the person supposed to make the decisions. Sometimes we leave that thing just like that. At the end of the day, the whole facility will suffer. But in the way you make a decision, you can consult your in charge in a way, even in the absence of the in charge, the input that the person will also bring will help you to make effective decision of which it will help the whole facility of which you are working in problem solving. So sometimes there are in your area of working, you can solve it internally. It means you can solve within your small area, your unit before when it's escalated or when you may you're not having any yield or you're not having positive outcome of what you've done. You can just raise that to the next level. Strategic planning is very important. So you need to take that. So the key strategy for strengthening the nurse leadership for quality health care and global impact includes developing leadership skills. So as a leader, you have skills, which involve focusing, you scan around as a leader, you focus, you mobilize, and doing all these things, it helps you become a leader. So wherever you are, you try to implement such issues that you come across so that will help you solve issues concerning that. So developing leadership skills, sometimes you normally wait for training, sometimes in a smaller way, maybe management will have a small leadership training for you guys. It's very beneficial. Sometimes you come for workshop, we advise you on some issues. It's also part of the leadership skills that you need to do. So in a way of maybe a facility having challenges, the person will also try to focus and try to mobilize funding and one of solving issues within the facility. Most of the nurses within this district, they are doing very well concerning that. Because sometimes there are issues, but they try to mobilize resources within their area. Without their stakeholders, and they try to solve this problem. Through their scan and the stakeholder maps, it helps them for that. Also, we need to empower nurses. Empowerment is very important. Empowerment in what form? Encouraging ourselves, among our peers, leadership encouraging you is also important. We not looking down upon ourselves, we knowing that we can do better. It's also part that we also need to do. Fostering collaboration, which has also been said, collaboration among other staff within our area. Even though the nurses were doing very well, you are very but you know you cannot work alone. Wherever you work and other people also work fast. So without other cadre within the facility, you alone cannot work. So collaboration is very key within our various areas where we work. And promoting evidence-based practices is also important for this strategy so that